Do you want to become a talk show host? Do you have a great idea? Passionate World Talk Radio is currently looking for podcast hosts for our Internet Talk radio station. Please email us at pwrnetworkllc@gmail.com with your name, email address, cell phone number, and podcast topic. In return, you will receive a 3-minute intro on air to a live audience about your podcast. Remember, just email us your name, email address, and your podcast topic, and in return, you will receive a free 3-minute intro on the air. How cool is that? Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
Well, hello and welcome. My name is Sheila Wilson, and I am a nurse. I am also president of Stop Healthcare Violence and a host on Passionate World Talk Radio. Today, I have Beckett Augat back to update us on the events of the Vincent strike. Our disclaimer today is the opinions of the guest may not represent the views of the host or the station. So here I go. Hello, Beckett. Please tell us the story of the turn of events.
I don't even know where we should begin, Sheila. So we actually went back to negotiations. They had come back. I don't remember if we had last spoken about. We had gone back and they had suggested an audit committee. I think we talked about that.
Yes, I think we did.
So after that, that was on a Monday. On a Friday, we started finding out that the nurses finally, after 8 and 9 weeks of being on strike, were getting unemployment. That we had won the labor dispute with unemployment. So all of a sudden, that Friday afternoon, St. Vincent's tenant reached out and wanted to negotiate again, miraculously. So Saturday we met with them, and it was a very short session because they had given the last proposal, which was, insulting to say the least. And they said, well, we have another creative couple ideas. So what they came back at us was with UMass's contract, where they had chicken scratched what they wanted and yellow worded what they did, and pretty much cherry picked through. And the interesting portion of all of this is that every single negotiation, I think this is what kind of annoys me even the most. I can take everything that they throw at us, but every session for the last few sessions that we've met, there's been an underlying hidden threat by their side with the attorney. This last time when he presented this great idea where they've now are negotiating against themselves because they'd already presented their proposal on Monday. On Friday, that following Saturday, they did a second proposal, and it was, proposal A is still on the table, but you can take proposal B, but, we think this is really good, and we don't know where we'll exactly be able to go from here since we put so much effort in. Just little words like that, little underlying threats is how I feel they are. I mean, that's my personal feeling. Every time I hear him say something like this, that's how I take it. And that just irritates. It's irritating. Like, those are the ones, that's the one thing I make sure that I put in quotes, and I've written it thoroughly, and I've just stay on it. So we met with them. They gave us 18 pages of fine print, and it's pretty much a photocopy of UMass's proposal. And they chicken scratched out, and he goes, we would expect you not to just cherry pick. We really put effort into this. They cherry picked. They took things like we have in our contract. that critical care patients will be treated the same regardless of where they are in the hospital. So that the only law that really has any effect on any patients that's in effect in Massachusetts is the ICU law. And that critical care patients will receive one-to-one care unless that nurse deems that they're able to take a second critical care patient, that patient is stable enough that they can take a second one. So they're supposed to have been doing this in our hospital this entire time. They've never done this in the emergency room. Or if they have, it has been very, very rare occurrences that we've had a one-to-one ICU patient where that nurse determines they can take a second one. So interesting enough, their contract, of course, we said, okay, well, this is a lot of work. We're going to, let's meet Wednesday. We want to set up on Monday to be able to go through this. And he says, well, are you going to take it to the members to vote on it? Well, there's nothing to vote on yet. We've got to go through it. We counter-propose. This is negotiations. This is not ratification. Ratification is at the end where the negotiation committee says to the bargaining unit, listen, this is a good contract. We highly suggest it. Here's all the points of it. This is why we ended up here. Do you agree with us? And the whole bargaining unit has a choice to say yes or no.
Right.
So I don't know where he thought we were going to take this to vote, but he had said that the last time, too, with the audit committee. And so, we had a Zoom meeting with our bargaining unit, and we asked them what they thought. And it was a resounding chorus of no's, amongst other more interesting verbiage about the audit committee, because he wanted us to take it to them to vote, which is not how this process works. And he's done a lot of these. He should know. The next, so we took this, we all took our, read it through it on Sunday, and we met the Teamsters. Local Teamsters were very wonderful to us. They allowed us to use their upper conference room, which could seat over 100, so that we could socially distance and be in a room together and do this.
That is awesome.
Oh, yeah. The other unions have been so amazing supporting us and rallying around us. But the Teamsters, they let us borrow that upper room. We were able to sit down. We spent 10 hours that day going through this 18-page proposal. And I'm telling you, it was a solid 10 hours. Breaking it down, dissecting it, because as I said, that critical care portion that we have, part of the thing that they cherry-picked was they put that in there. And their management at UMass, they split in a little piece that says should. So that one word of critical care patients will be treated the same or should be treated the same makes a huge difference, especially with who your managers are and your management team and your hospital ownership is. And we know that with tenant that would be abused. Well, it should be. We can't do it right now. So it was little tweaks like that and little cherry picking like that they absolutely tried to slide in. They, again, refused to talk about the emergency room really in any depth or put any limits on what we could take for patients. So 10 hours, and we went back to the table Wednesday, and we negotiated with them for 12 hours on Wednesday.
Oh, my word.
From 9 in the morning till 9 at night. We counter-proposed. We waited. They came back and they counter-proposed. We went back and we counter-proposed, and at the last one, we did that about 8 o'clock, and they said, okay, we'll get back to you, 8 p.m. So about 9 o'clock, the mediator comes into our room and says they will not be returning. And, we'd said, well, we can always meet on Friday. She goes, I'll parlay that. So she goes back. She goes, they'll let us know. So Thursday, late afternoon, we're waiting to find out if we're going to be meeting with them on Friday to do more negotiations. They had the mediator come back to us and pretty much say that they expected us to negotiate against ourselves, that they did not see that this coming to a solution unless we gave them a proposal more closely in line with theirs, and that the strike would obviously be continuing, and now they will be forced to hire our replacements.
Oh.
So, we're back to the fact that this is a labor dispute. It's not a monetary, economic dispute. So they could try, and they have the right to do it, but they also have had quite a few unfair labor practices that they've done. And, lawyers are working on filing things. So this is going to be an interesting situation of if they get found, or if the National Labor Board decides that this unfair labor practice is in fact something worth looking into, they're not going to be allowed to hire anybody.
Wow. Now, would they be able to move fast on this?
We're hoping so. The other portion of this is that they had 80 nursing positions already open when we left. There are 720 nurses out on the line. So you tell me where you're going to find 800 nurses that are going to want to cross a strike line with the nurses out saying how deplorable it is inside, how the ratios are unsafe, how the benefits are poor, the pay is poor considering the two hospitals just down the street. As I've said, I pay $150 copay. I think it's $150 right now. I thought it had gone up, but I'm not going to be quoting correctly. To go to my own ER with the insurance they provide me, and
you have to pay that amount of money.
That copay, and my girlfriend who works down the street, and she doesn't work in the ER. She works at UMass, but not in the ER. She pays $25 for her copay to go to the ER there.
Wow.
Yeah. So, there's some significant changes.
Now, how is UMass affiliated with St. Vincent's?
They're not. They're a competition, to be honest. If they're a state-run hospital, so they have pensions, they have it's not so much competition between the nurses, because the nurses, we go between the hospitals all the time, but it's, for St. Vincent's, it's definitely a competition, because if a patient chooses to go to UMass and not St. Vincent's, that's taking money out of St. Vincent's pockets. That's how they look at it.
Right.
But there's different pros and cons. Like, we are known for being a cardiac center and known for being a stroke center. UMass is definitely known for being trauma and pediatrics. So we all have our different, and then there's UMass Memorial, which is kind of between us, and they are known for their specialty in labor and delivery and high risk and their NICU. So we've all kind of have our little niches of specialities.
Right, right.
But UMass is a nonprofit. They're state-funded. So
just to clarify it for me, that the people that negotiate for St. Vincent's went to UMass and took out their basic negotiation plans?
Yep, they took the contract that the M&A has with UMass, because M&A is also in there. They took the contract that the nurses have there and used it as their guideline. And now the interesting portion of this is, there is always going to be comparison. They are the competitors right up the hill. We could go there to get a job very easily. And so there's always going to be a little bit of comparison and looking at numbers and ratios. And we've talked to our nurses. We have, there's nurses who work per diem at St. V's, per diem at UMass. Per diem at St. V's, they were making $7 less an hour. But that's significant. That's not a little bit. That's a pretty significant hint. You take 70 cents, okay, but $7, that's pretty big.
Yeah.
The dog's going off. So, $7 is a lot. You have some nurses who work full-time at St. V's and pick up per diem there. So there's a lot of going between. But when you talk to the nurses over there and you talk to the ones who do work between, they're like, yep, we have 4 patients. Rarely we have to go up to 5. Or, sometimes we have 5, but we rarely have to go up to
7.
So very rarely do they have to go up, to more. Never up to 7. So
no.
There's this ongoing, just looking at what each other does and what the management team does. The management team doesn't go over there and flex a nurse mid-shift to force boarding in the ER to then force the night shift to take extra patients because now they're in the red zone, which means that we're boarding so many patients they use it as ability to force the nurses upstairs to go over their numbers.
Just unbelievable what they can do. It just doesn't seem right.
No, it doesn't. So they do stuff like that all the time. And so they said, well, you wanted to be like UMass. You wanted UMass's contract. No, we would like UMass's management, not necessarily UMass's contract. So we would like you to follow the rules like they follow the rules. We'd like you to have they don't have to say 1 to 4 because they take acuity into it. You don't. So yes, as a point of comparison, since they're our neighbors and, you're always comparing with the Joneses,
right.
We're going to compare, but we're not going to say that's exactly what we want. So now
right.
Carolyn Jackson, the CEO of Safety, goes, you know what, we've given them everything they've wanted. They wanted UMass's contract, and now we've given it to them, which is not the case. It was never said we wanted UMass's contract, nor did they give us exactly what they wanted because they cherry-picked through it and picked all the things that would benefit them to be able to, again, continue to abuse the nurses and put patients at risk by doing increased numbers and increased acuity. So
that's it. And Carolyn Jackson is not one that has been known for patients, right?
No, I think she was the one who referred to them in an article as widgets, because she's a chemical engineer with her master's in her MBA from Harvard, and one of her Harvard friends helped her get here. But it would be an interesting study for anybody who wants to take a look at it and see what happened to the hospital she worked at in Philadelphia. And she's actually brought people with her from there that have some interesting situations going on with them right now up here. So it doesn't seem like her style of leadership has been beneficial at any hospital that she has been at.
Yeah, it's. But I am just kind of surprised that the CEO of a very well-known hospital would call her patients widgets or make a comparison to that.
Where's the problem is that they're not her patients. She's never been bedside. She's never been a nurse. She's never been a CNA. She's never been a PA. She's never done any of that. She's never changed a patient. She's never held one's hand while they're dying. Maybe a family member, but not somebody who's not related to you, not somebody that's there and dependent on you for their care, for their life. She's never done that. She was a chemical engineer who got her master's in business. So she doesn't consider them, patients. They're not her patients. They're our patients. And that's why as nurses, we're advocating so loudly and so hardly. Monday it'll be our 11th week of the strike. I don't see the nurses breaking because we're not fighting for ourselves. We're not fighting for our pocketbook. We put ourselves, our families on the line and at risk financially, health-wise, because COBRA, we don't have, COBRA is very expensive, and we didn't have anything to pay for it for 8 weeks, 9 weeks. Well, legislative just moved that as of April 1st, it has to be subsidized even for striking workers. tenant has a deadline of May 31st to have that paperwork filled and sent out. The union, our M&A director, got a jump on it, got the paperwork, created the form, filled it out, had us all filled it out, certified, sent it to them. They were so busy doing what they should, which is benefit the community and make sure the nurses that are on strike are able to have access to their health insurance, that they took the time to send us a letter telling us that the M&A was lying and that it couldn't be done earlier and that they had a 31st deadline. So that they were delaying it for 3 weeks.
Wow.
They didn't put
How
in so
can
much
you trust
word,
people?
but they couldn't wait to say that the M&A was lying and feeding us lies again.
And so what was M&A's response to that?
We know it's a lie. We know what the legislators filed through and the laws out there. Just because we got the paperwork done earlier because it benefits our nurses to have their health insurance and for their families to have their health insurance. I mean, we have some nurses that have some very sick children, some very sick husbands, spouses, and we wanted them to have access to it as soon as they could.
Right.
And, Tenet just again proved how careless they are with people's lives, their own employees at this time. And let's go one step further, is that they're so interesting on their different deadlines. So on Mother's Day, they took a full-page ad out against us, again, telling us how disappointed, despicable, how, doing this during a pandemic where, again, we've got to be reminded that Carolyn Jackson furloughed nurses, housekeeping, secretaries, everybody during the first surge of the pandemic and had the per diems working more and then wasn't willing to pay the per diems, the bonus that they were going to offer the rest of the staff because they worked more hours. And the other staff had been furloughed. So, again, another way for them to save money and say, yeah, you don't mean much to us, to the employees. So they took a full-page ad out on us on Mother's Day, which most of us are moms. On Florence Nightingale's birthday, the last day of Nurses Week, they posted the first 50 positions where they labeled it ICU 36 hours strike worker replacements. That was the ad. That's how they took it out. So that was interesting. So that's the day they chose for that. Then we found out, which is even more interesting and even kind of more ironic, is that they, for Nurses Week, gave out a deck of cards, a regular deck of cards except for the backside's purple and says, of course, St. Vincent Hospital, creating a community of care. How tongue-in-cheek is that? So because, we have so much time that we can sit around playing cards, back to that senator of April 2019.
Wow.
And it's kind of funny because September of 2019, I was actually at an M&A convention, and it just kind of enlightened me. Not even enlightened me, but just I was already well aware of the differences between the union, the M&A and Tenet. And the M&A had given us cards in September of 2019 saying patient safety, legislative active, workplace advocacy, nurse education, and the point of the cards was working together to ensure safe patient care is no game. And 36 of the cards, numbers 2 through 10, were all pictures of the nurses that form the M&A with their strike signs advocating for safe patient care.
Wow.
So if that didn't bring to an absolute point, a very poignant point of the difference between these facilities. And it's funny because, St. Vincent's was in big letters, and the only portion on these cards that really said M&A was, of course, any of the signs that we were holding, but also the back of it, it's a small print of the M&A's actual, a logo. And then the jokers are fat cats.
The jokers are fat cats. Is that what you just said?
Yes, the Joker is Fat Cat. Is a fat cat,
Wow.
which is, appropriate.
Yeah, for them.
Mhm.
So now what is the plan of action that's going to happen?
So tomorrow,
you're going to have that.
We have a rally against replacement. Congressman Jim McGovern and Congresswoman Lori Trahan are going to be hosting it. It's going to be tomorrow at 9:30 a.m., and it's going to be on the strike line on Summer Street outside of St. Vincent Hospital. So we're highly encouraging our community to come out. Anybody, our family, our friends, obviously will be there. But it's huge. It's time that they realize that they don't have the support that they seem to think they have. And, I cannot tell you enough how many times I've heard from other nurses or even felt it myself, just how humbled we are by the support of the community. My church has been working with a food project, community food project group that does 30 pounds of food. It's a box. It has milk, cheese, a different type of meat or two, veggies, fruit, all in this box. And it's 30 pounds each, and it's donated. It's free. So for the last 5 weeks, we'll be going on 6 weeks. We've been going down there. The first week, we weren't kind of sure how many we need. We went down with a couple pickup trucks and picked them up. The second week, the M&A rented a U-Haul for us.
Wow.
And we were able to pick up 4 pallets of food. So that's 168 boxes of food. Last week we had 5 pallets. We had 220 boxes is what Paul and I figured out. And the nurses can come in. They can take 1, 2 boxes. Some nurses that have 5 kids can go through 5 things of milk easily. Other nurses who can't drink the milk, they're helping each other out, swapping milk. Whatever they won't take, they're putting in the fridge and putting a note out front. Somebody went to Starbucks, which is right next door to our strike headquarters, to get her tea, and was told her tea was free because somebody had come in and said, any nurse that comes in here from the strike line, here's money to pay for theirs ahead of time. Not only that, but Starbucks has been fantastic to us in donating coffee every day to our strike office. I mean, it's just been overwhelmingly humbling how well we've been treated by the community. And then in the retrospect of it is like when we've had extra food boxes, we have a low project housing that is right behind us. And we've been bringing the extra food boxes over there and talking with the community and educating them. But it's just, one of the days that we were doing the food box, this gentleman came up to the food box, came up to us at the truck, and he waited in line. And I thought he was there like as a husband picking up a food box or something. And he came up and handed me $50 in cash and said, I am so sorry for what you guys are going through. My wife and I support you. Unfortunately, my wife is in there right now without you guys having surgery, and it breaks my heart, and I'm so afraid for her.
Rightfully so.
So he's worried about his wife, but then he's coming over to figure out a way to give back to us.
Yeah.
And it was just like I had to swallow a few times because I thought I was going to start to cry. And there's been a lot of those moments where it's not like for me, it's not the fear, it's not the stress, but it's just we're so used to taking care of everybody else, and now to see the community coming around us and embracing us, it's moving, it's very humbling, but it's so very touching.
It is. To have all of these people, even honking the horns, giving a wave.
Yep.
All of that stuff means so much.
It does. It really, truly does. Especially like those cold nights that you're out there and you're walking and you're just trudging along, and then somebody honks and you're like, oh, they didn't forget about
Right. They noticed I'm out here. Well, you nurses have been out there in the rain, snow, sleet, cold. Today was hot. The wind, yes.
With all the sand, oh my gosh, sometimes it felt like you were getting a free dermal abrasion.
Right.
The wind was so bad you were holding your sign up in front of your face.
Yeah. No, and it's true. I mean, you girls, I am so impressed with so many of you out there and doing what you're doing.
It has to be done.
Right. But then you go and you sit at a table and listen to, well, the BS, I guess you'd call it. They think that you're all kind of not educated or something. And all you want is staff to take care of your patients.
Yeah, and the last I heard about a week ago is that they've spent $65 million to fight this.
$65 million.
So far.
To fight it. For what?
So for
see, I don't.
The Worcester PD detail, the extra security, then the replacement nurses that they have coming in by agency, they have to pay for their hotels, for their food, for the buses to transport them in.
And they've paid $65 million?
They've paid out $65 million so far to fight this, to do all that, to fight us on having some more nurses.
And they could have taken that $65 million, given you the staff that you need. It's not like, oh, we want 10 extra on our floor because we want to sit down and play cards. Oh, we'll use St. Vincent's cards.
Yeah, exactly.
That's all you want, is to take care of your patients.
I think for the emergency room, we figured out it was like 3 more nurses in the 7 to 11. It was 2 more nurses, 11 to 11, and overnights it was like 3 or 4 more nurses. To bring us up to par, because we haven't had our staffing numbers are changed in 13 years that I've been there. And it's changed. We've added a psychiatric unit. We've added a COVID area. It's changed. The acuity has changed. The patients have gotten sicker over in the last 13 years.
Oh, they certainly have.
They don't want to acknowledge it.
That's because they don't know anything about health care, apparently.
No,
a widget never got sick.
No, but widgets don't get sick. You're right.
And that's
absolutely true.
I just don't, in my pea brain, I just don't understand the rationale as to why they don't understand to take care of their patients. They would be making more money because more people would be coming in. I don't know if your census has gone down at all. I'd be afraid to walk into that hospital. Not that the nurses that they, hired or replaced aren't smart. They don't know the place. You have nurses that have worked 40 years. They know everything in that hospital.
Well, which brings us back to them thinking they can hire, too, is that out of the nurse educator department, because they are covered under our contract, only 1 nurse educator stayed behind.
Oh.
So their threat's even more empty in the fact that they have 800 nurses that they need to hire and 1 nurse educator to train them. In the policies and procedures, they're very specific, hospital to hospital. We also have a cancer center, an infusion center, a radiology oncology. These are very specific areas, and they're very hard to hire for. The OR, they're all out with us. Do you know how hard it was for them to even get one traveler, to help with the staffing in the OR, never mind to replace the entire OR staff?
Unbelievable.
We've had usually 12, and I think at the last count it was about 19 open positions in the emergency room. And we have 25 nurses out right now. So how easy is it going to be able to find those positions? So
wow.
A lot of it, they're doing this, and they're doing it on very poignant days of Nurses Week, and Florence Nightingale is trying to provide that underlying threat to scare the nurses on the strike line, because COBRA's coming up, and they have their deadline looming over their head, and we knew. Sorry.
Quite all right.
We knew that this tactic was coming down the line already.
Right.
It's just another union tactic that they do.
Now, just out of curiosity, many months ago, I had interviewed you, and it was kind of like at the beginning, and you told me that there was 2 different gangs close to St. Vincent's, and that you had fought to get a metal detector, and they had it. And I don't know who was the CEO at that time, but are you using the metal detector yet?
The metal detector went in just before we went on strike. I think they tried to use it as a last-ditch effort to keep us in. Come to find out, they didn't have just one, but they had 2 metal detectors up there. What we found out was that they had the one that they had been given on a grant back in 2001 after 9/11. But then they had also, in the last few years, purchased a second one that was still in a box that nobody knew about. Very lucky for us, or lucky for Tenant, a gentleman who used to be in used to be in a position higher. Had come into the hospital and run into somebody from security, and the security person mentioned to them that the metal detector had gone up, but it was old and outdated, and he goes, well, what about the one that was sitting up in the box? Sure enough, there's one sitting up there in a box. So now that one is up and running. However, they didn't want to increase security staffing to staff it correctly or to staff the rest of the hospital correctly. So now that's going to be a bigger concern when we go back, is whether or not they're staffing it right. It is in our contract now that they will keep it and maintain it. That was one of the alterations that we made to our contracts. But it's sad that we had to actually put it on the nurses' backs for their own safety.
A lot of this just doesn't make common sense. They should be able to staff that, the metal detector, to help save the lives of anybody or the incidents. And I don't know if you remember Lisa Wilson.
Oh, well, that
she
was
yeah,
no, I started fighting very hard. They actually had her removed at one point from one of our meetings that we had invited her to, because we were fighting for the metal detector. So I'm very familiar with that incident. And, she's very lucky to be alive. And we've had enough of our own close situations that we're lucky we haven't lost staff. And it's been pointed out to them time and time again, and they just didn't care until we put it into the contract and we're threatening to strike.
Well, it should be very embarrassing that you got a metal detector through a grant and you never used it because you're too cheap to pay a security guard to sit there to watch what comes through.
Yep.
And now with the laws, I don't know in your area, in a patient with mental health problems that is supposedly there for, evaluation to be able to get into a psychiatric ward, you can't undress them. You can't, if you look at them and you feel as though there's something that might look like a gun or a knife, you may be able to address that person and ask them to take it out of their pocket. I don't know if you had the same rules, but those were the rules when I was in the ER.
They created a policy in our emergency room that they have scrubs that they provide for them to change into because they decrease ligature risk. So they can't hang themselves with these scrubs. They can't hang themselves with these scrubs, whereas with regular clothes they could. So these scrubs are kind of like a paper thin. They'll rip if any weight's put onto them. So policy and procedure is that they have to change into these scrubs, and we give them a pair of socks, but it's to help decrease risk of injury.
To them?
Yeah.
Or to you?
To them.
To them. Right. This is...
But there's also no pockets or anything for them to be able to, carry a weapon in those in.
Well, that's good. Now, I hear your cough is getting there, Beckett. Do you want to say anything else?
The allergies, the pollen's kicking my butt this year. It's just community support. If you're down there and you see the nurses, honk, wave, come grab a sign and walk with us for a little bit. Every nurse is very educated on why we're out there, why it's so important to our community. And it is. This is our community. A lot of us use St. Vincent's as our hospital. We have our families go there.
One of your nurses said that she knew so many of the patients. And, she takes care of the community. And they really are missing all you guys.
And our patients know who we are.
Yes.
And, we're missing being at the bedside. We're missing being with our patients too. This is not, it wasn't an easy decision to do. There's a lot of factors that weigh in, like, how is your family going to maintain? How is, health-wise, people who have families who have medicines. But there were 720 of us who said our patients are worth it. We will figure it out. We always can. The union the MNA, Massachusetts Nurses Association, has been fantastic with us every step of the way. The unemployment, we were having a hard time with that. Tenant was dragging its feet. They've had MNA employees coming in to help the nurses fill out the forms correctly, create a unit, grab everybody's name so that anybody who's still having a hard time, they can help them get it fixed. It's just been an ongoing fight and struggle, and everybody has their bad days, their good days, and we lift each other up. And we remember, in the end of it, is that it's as hard as it is for us, we remember what it was like in there and how horrible we would feel when we couldn't give the care that we should be giving. Right. When we felt like we were failing our patients at our job daily. And it renews the strength to just keep on trucking, to keep on going and saying, yeah, this isn't going to happen anymore.
Right. No, it's going out on strike is not easy. And you girls, or I shouldn't say girls because there's plenty of men out there, you nurses have really got a lot of support. So thank you, Beckett, for sharing this information. And I'd truly like to know exactly what the community is thinking about. What?
But I just
okay, let me.
In.
All right, that's good. I'm glad you said that. Let me finish, okay? I'll start over again. Thank you, Beckett, for sharing this information. Your community is giving you a lot of support, and I would like to thank Lillian Caldwell, CEO of Passionate World Talk Radio, and Dwight, station manager, that does all the blogs and posts all of the shows. Thank you again.
Do you want to become a talk show host? Do you have a great idea? Passionate World Talk Radio is currently looking for podcast hosts for our Internet Talk radio station. Please email us at pwrnetworkllc@gmail.com with your name, email address, cell phone number, and podcast topic. In return, you will receive a 3-minute intro on air to a live audience about your podcast. Remember, just email us your name, email address, and your podcast topic, and in return, you will receive a free 3-minute intro on the air. How cool is that? Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook Live, LinkedIn, and all the other podcast directories one can find on the internet.